I have to say the meeting was so incredible with so much great science. I don't think I can pick just one study. So I'm going to pick two studies, the LAAOS study and the ADAPTABLE study. So the LAAOS study was left atrial appendage occlusion at the time of surgery. And what I really liked about the study was that in a way it validated what a lot of us have been doing in practice sort of as common sense. So it showed us that occluding the left atrial appendage at the time of surgery actually results in reduction in stroke and systemic embolism and appears to be very safe. And I think this is really a practice changing study because of the magnitude of benefit that we saw on top of systemic anticoagulation. So that was my first favorite study. My second one was the ADAPTABLE study, which asked the question of aspirin 81 milligrams versus 325 milligrams for patients with established ASCVD. And, more than even the outcomes of the study, what I really liked about the study was the study design. So I think this study really pushes the envelope and really helps us to think about novel ways in which to do clinical trials. So the enrollment for the study actually occurred through the electronic health record. And then the endpoints that they collected occurred through ICD-10 data. And for the fatal endpoints, they actually looked at claims data. Of course, there were limitations to the study because it was unblinded. You were using patients to sort of self-enroll. It was a little more challenging to blind patients. But overall, I think it showed us that this type of a pragmatic real world clinical trial is very possible. And it can be used to answer a lot of the questions that we see in our day-to-day practice that are very important and relevant. Yeah, I thought the science this year was really incredible. And of course, this is our second year now during a global pandemic. And a few things really stood out to me as to what really impressed me. The first was that there was really an ability to embrace the novel disease that we're dealing with. So there was a lot of good data coming out, like with DARE-19 and with action about COVID and how to manage COVID. So, for investigators to put together a clinical trial, enroll it during COVID, and then present the results during a global pandemic, I thought was incredibly impressive. Of course, we saw a little bit of a shift to thinking outside of the pill box. So we saw renal denervation make a little bit of a comeback as well. We also saw interventions like intensive cardiac rehab leading to improved quality of life and improved 6-minute walk tests and other such things. So there was a little bit of a theme of let's think beyond just adding more medications. And then what I really enjoyed as well was the application of the drugs that exist in our clinical practice to novel diseases. So thinking about the use of, an SGLT2 inhibitor in a condition like COVID to see whether it improves outcomes. Thinking about whether an ARNI used in advanced heart failure is likely to offer the same benefit or not. And so I think those were the main themes that really stood out to me is, looking at the novel diseases, thinking about how we can take a little bit of a stance outside of the pill box and look at non-pharmacologic ways to improve outcomes. And then also thinking about using the drugs that we have in our armamentarium for novel applications and trying to see if we can improve outcomes with those. I have to say, I think I have a love-hate relationship with the all-digital format. So I absolutely love the fact that it's opened up the entire world to everybody. Access is incredible. I don't have to put time away from my patients or my practice or whatever. And I could be in my house and with my family and just pop on in a meeting and get amazing science at my fingertips, literally in my living room. But on the other hand, I have to say that it's a double-edged sword. And because I'm not taking time away from the practice and away from all of the things that are, competing for my time, sometimes it is very difficult to be fully engaged on a digital platform. And Zoom fatigue, obviously, we're all familiar with it. It can really get to us because after a while, sitting and looking at a screen is very different than interacting with people in person. So, I think for the time being, it is obviously the safest and best thing for all of us to do until we get vaccinated. But I am really looking forward to going back to the in-person format where we can catch up over drinks, we can collaborate, we can share ideas, and we can enjoy the incredible science at the same time. I just have to say it's been a really incredible, literally once in a lifetime type of year in the last year. And I'm so incredibly proud of my colleagues and my friends who have put together some really amazing science and the ACC for putting together a really stellar meeting and, doing it during a global pandemic. And I have to say that what last year has really taught us is that medicine and science continues to, deal us surprises every single day. And as physicians, I think one of the best ways that we can continue to battle disease and emerge victorious, like we did in this last year in our fight against COVID, is to continue to learn from the new science. So, the last year has really been a triumph for science, with vaccines coming in such a short period of time. And I think it's really symbolic of all the same progress that we continue to make in the field of cardiovascular disease, which we all know is not just a pandemic, but it's an epidemic that's going to last long after COVID is over. So I'm really glad that we were able to learn all this great science, and I can't wait for more meetings like this in the future where we can continue to share all of this great research and data.